Hi everyone, this is Dr. Patel, and I'm coming to you representing Gaya Wellness. And today's topic for our live is going to be, should I get STD screening? STD screening is pretty important, or rather the more appropriate term for it is STI screening, sexually transmitted infections, because it is something that everyone in any age group can be affected by. Truth be told, traditional guidelines used to really focus on women within the age groups of anyone who's sexually active, age 18 to approximately 25. But really speaking, we're sexually active a lot earlier than that, and we're sexually active for a lot longer thereafter. And so if you are sexually active and you have been exposed to more than one sexual partner, then it's pretty important for you to have routine STD or STI screening. And the most common infections that can be something screened for are chlamydia, gonorrhea, syphilis, or viral infections such as HSV or herpes simplex, HIV, or hepatitis, or another common one that kind of doesn't get enough attention is HPV, human papillomavirus. And viral infections, it's very important to understand, they don't always show up when you acquire them. So in other words, don't go chasing after the first person you had sex with most recently because you tested positive for a viral infection. Chances are, if you've had sex with anybody else in your past, you can't really narrow down when you may have acquired that viral infection unless you had a definite negative test time stamping the last time you for sure were negative. Bacterial infections, however, are actually a little different, and those are the ones where you can go running down the street with a golf club chasing somebody. No recent, golf pros in mind. But bacterial infections usually occur and are detected within the vicinity of when they are acquired. So for instance, if you test positive for gonorrhea or chlamydia, then chances are that the person you're sleeping with is sleeping with somebody else, and that is who you acquired it from. A lot of my patients will feel like STD or STI screening is not that important because they're sleeping with only one person, or they're in a monogamous relationship. And I often bring up the point, like, you might be in a monogamous relationship, but is your monogamous relationship with a monogamous partner? And when you're even applying for a car or a loan or a mortgage, everybody gets to look at your credit history. Why on earth do we make ourselves so exposed and vulnerable when it comes to sexual partners? Ask about their medical history, and if they feel comfortable sharing it with you, then at least you have a full actual report of, yes, this person has not been exposed to anything, and I am safe to have sex with them if I'm considering not using condoms anymore. And vice versa, because that way everyone's cards are on the table. Otherwise, consistent use of condoms prevents the transmission of chlamydia and other things. So what are some of the treatments? If you test positive for a bacterial infection, then typically we would treat you with antibiotics. So for chlamydia, gonorrhea, syphilis, trichomonas vaginalis, these are all sexually transmitted infections that can be treated with antibiotics very swiftly. It's very important that you are also having your partner or partners tested and treated, and that you're not engaging in sex with them until you're confident that they have cleared the infection as well as you have. Nothing worse than getting an infection more than one from the same person or from anyone. And the reason why treatment is so important, especially in women, is because we will harbor the effects of that infection far longer than our male counterparts. So in other words, if you have an infection and it goes untreated for quite some time, the effect on your pelvic organs, including your cervix, your uterus, your fallopian tubes, sometimes even up to as far as high as your ovaries, it can have a long-lasting effect, which then significantly may impact your fertility. I did a Facebook Live recently on ectopic pregnancies, and one of the big risk factors for that was a history of sexually transmitted infection that then went up traveling through your fallopian tubes and caused inflammation and trauma to the fallopian tubes. So having a sexually transmitted infection such as gonorrhea, chlamydia, it can traumatize your cervix, uterus, and fallopian tubes to the extent where it can actually cause long-term effects on fertility, as well as the immediate effects, which is you can have some pretty strong pain, discharge that looks kind of funky, yellowish, purulent kind of stuff, sometimes mixed in with blood. But the biggest thing usually is pain. Now, the other side of this coin is women can go around without any symptoms and not know that they're actually positive or have been infected with a bacterial infection, which is why waiting on symptoms is really not what you want to do if there's any chance that you may have been exposed. First thing and foremost, if you're having sex with someone and you have not used protection and there's any suspicion or concern, just go ahead, talk to your doctor. Tests are very easy to do, and you can find out within a couple of days if you need to be treated, if you need to talk to your partner about being treated. As for viral infections, they typically take longer to show up, and they typically take longer to clear. Viral infections are annoying in that they know how to hide in our body. So in other words, unless they're hanging out in the common areas, you can't really knock them out like a whack-a-mole with treatment. Which is why, first of all, even from the time of exposure, there can be a downtime as to when your body actually shows positive for the test. So if you are concerned about exposure, have your blood test done. That's right, viral infections are typically tested with blood tests. There are some exceptions, but have your blood test done. And if it's negative, great, but go back in a couple of months and have it retested, because a negative test once may just be the time where the virus is hiding in its little, under bunker kind of space. If you have negative test results a couple of months apart, then you can be a lot more confident that you are truly negative for that viral infection. In the interim though, you could, if there's any concern or there's a high suspicion of exposure, then the best thing to do is take prophylactic antiviral treatment. And that's where we give you treatment for, knocking out that virus, even if it may not be there. But in the event that it is, and you're just not testing positive yet, then the duration of treatment usually will last a few months to make sure that at any point in time, if the exposed virus rears its head, we knock it out and you are at the lowest risk of having a long-term infection. Okay, so to recap, sexually transmitted infections, most people think that they are tested for that when they go to their gynecologist. Big misconception. If you don't necessarily ask for screening, you may not actually receive it. Even though it's called screening, not everybody qualifies for what insurance companies consider to be appropriate screening. So if you are anyone within the age of 18 to 25, routine screening for STDs is happening. But if you are any age outside of that window, or if you're going for a visit outside of your annual exam, gynecologists may not actually screen you, A, because it may not be necessary, and B, because it's probably not going to be paid for by your insurance company, and you're going to get this cost that you're not going to be happy about. So specifically ask if you want to be screen for STIs. And then the other thing is, don't presume you're being tested, because a comprehensive STI screening includes cultures that can be done with a pelvic exam as well as blood tests. Most viral infections are usually detected using blood tests. So if you were like, oh, I had everything screened, my first question usually is, did you get blood work? And if you say no, then I know you didn't have a comprehensive screening. Next, making sure that you know which kinds of infections you could be exposed to. So chlamydia is one of the more common ones in terms of bacterial infections, but gonorrhea is right up there. And in fact, if you live in the villages, there's been a recent uptick in STI infections with chlamydia and gonorrhea. So those folks are having fun, bravo to them. In the other potential infections include syphilis or trichomonas vaginalis. These are all treated by antibiotics. If you test positive, you want to look left, you want to look right, and you want to make sure that anybody you're having sex with knows about it, and you probably want to have a conversation about who else they're having sex with, because you did not get it from very feisty toilet seat. Viral infections, HIV, HSV or herpes, HPV or human papillomavirus, hepatitis, some of the more common ones. These are tested using blood tests, usually, some exceptions. And if you test negative, but you have a high suspicion of exposure, then you most likely will come back to have a repeat testing done in a few months. And to be on the safe side, if you, again, have a high suspicion of exposure, be sure to ask your doctor or talk to your doctor about prophylaxis so that you can make sure you are at the lowest risk possible. All right, guys, that is all today for STI screening. And quick updates, I am going to be actually hosting an event, a small focus group of some sorts to discuss some of the major decisions coming up for Gaya Wellness. The event is going to be in June, and I would like to actually hear from some of my most prolific patients and fans and followers. So if you feel like you've been really part of this journey, you've been really giving a lot of feedback, or if you would like to, I would love to hear from you. Send me a direct message and I'd like to invite you out to this small focus group event. I'm planning on having about 20 attendees where you will have a great little festive time. We're gonna have drinks, we're gonna have food, and we're gonna talk about some of what your thoughts are on some of the things that I'd like to embark on. So again, if you're interested and you have already been very proactive and prolific in this journey for me, I would love to hear from you some more. If you would like to become more active, also would love to hear from you. Send me a direct message and I will select about 15 to 20 patients or followers and have you guys attend this event in June. Thank you so much. Next Facebook Live will be on Thursday, and I will